need to have the skin sterilizer, we need to have 10% povidone iodine and some sterile gauges. We need to have 2% lignocaine injection for anesthesia. We need to have clear, clean slides for making the smears. We need sterile gloves and a kidney disc with the autoclave and clean aseptic bone marrow aspiration needle. Of course, we need syringes for anesthesia as well as aspirating the bone marrow from the bone. Let's see the step-by-step process of bone marrow aspiration. First step is always informed consent. Second step is to take a proper history and clinical examination prior to starting the procedure. Why it is important? Because for interpretation of the bone marrow, a good history and clinical examination findings are always helpful. Third, we need to select the site from which we need to aspirate. We need to do proper dressing and draping of the site of bone marrow aspiration. We need to inject the local anesthetic prior to bone marrow aspiration to prevent the pain. Sometimes we need to approximate the depth of the periosteum prior to putting in the needle. This is done by the very syringe through which we give the local anesthesia. Why it is important? Because we need to be sure that we do not go beyond the sternum and injure the underlying vital structures. Step 7, we need to insert the needle into the bone marrow in a corkscrew movement till there is a give away sensation. Step 8, we remove the stellate and aspirate the bone marrow by a 10 ml syringe. Step 9, we prepare the smears from the aspirated marrow, and step 10, we do the aseptic dressing of the aspirate site. We must not forget step 11, where we aspirate 2 ml of venous blood for peripheral blood smear of the patient which is requiring bone marrow aspiration. I will be showing you few photographs and videos detailing the bone marrow aspiration. Here we can see Professor Vidyut Krishna Goswami. He is the professor and head of Department of Pathology at North Bengal Medical College, and he is demonstrating the procedure of bone marrow aspiration. In this picture, he is taking the clinical history. He is examining the patient to look for any features of hematological diseases. Next, we need to position the patient according to our need. If we are aspirating from the posterior superior iliac spine, we can position the patient into a left lateral position or to a prone position. Next, we actually do the antiseptic dressing and draping. This is done by using skin disinfectants like chlorhexidine with spirit or chlorhexidine with ethanol. This is done by using chlorhexidine with ethanol followed by using 10% povidone iodine, then again using the chlorhexidine and ethanol to get a good asepsis. Next step is the anesthesia. Local anesthesia is done by using 2% lignocaine. We need to inject a adequate amount of 2% lignocaine into the site in and around the posterior superior iliac spine. This is done through a 5 ml syringe, and it is done slowly over 1 to 2 minutes, and we need to wait for 5 minutes before we start the real procedure of bone marrow aspiration. Here the video is showing how Professor Goswami is aspirating the bone marrow. He is using a cotton pad to act as a cushion between the bone marrow aspiration needle and his palm. As you can see, bone marrow aspiration needs strength. He is using the leverage. As you can see, bone marrow aspiration needs strength, and he is using the stool to get to the position where he can increase all his strength. Now he has got into the bone marrow. How he knows that? He knows that when it our kurma. As you can see, he is inserting the bone marrow needle into the bone marrow in a corkscrew fashion. He is inserting it till he gets a give away sensation. Now the bone marrow needle is perfectly still. It is inside the bone marrow. It is freely moving inside the bone marrow. Then he removes the stellate and takes a 10 ml syringe which has been pre-citrated. Some amount of citrate has been put into it, and he is aspirating the bone marrow through the needle. After we have aspirated the bone marrow material into the syringe, we take out the syringe and then make some smears out of it. So how to make the smears? Here we can see Professor Goswami has aspirated the bone marrow into a 10 ml syringe. There is no fear of the aspirate being coagulated because we have pre-citrated the syringe. Now the aspirate is taken to a group of slides which are already placed over a blotting paper. The aspirate is dripped upon the slides which are slanted. Now the excess blood gets absorbed in the blotting paper and the small bits of tissue of bone marrow which is present in this aspirate gets adhered to the slides upon which the aspirate is being put. The excess of blood can be re-aspirated in the syringe to make a separate smear. Our next step will be to make smears from these small bits of bone marrow tissue which is being adhered to the slides. Here we can see he is putting all the material left into a fresh slide and then he is going to make smears out of it. He is taking the smear and he is removing the excess blood into the blotting paper. He is taking a fresh slide and scraping off the bone marrow material into a fresh slide. We can see the small bits of tissues which are the actual bone marrow particles. Now this scraped off bone marrow particle is spread out into a new slide which acts as the smear. So we can have a look into the slide over a white background. This process is repeated to make different slides from the aspirated material. He is taking another slide and the bits of tissues are being scraped off and he is drawing the tissue into another slide to make a smear. Meanwhile, the assistant of the procedure has aseptically dressed the bone marrow aspiration site. So we have learned how to get inside the bone marrow and draw the aspirate from the spongy part. Ultimately, the smears made are air dried and the materials are stained. Normally, the stains used are Leishman stain, Pearl stain and MG Giemsa stain. Lastly, we'll learn something about the interpretation of a bone marrow aspiration slide. After staining, the slides are examined under a microscope and the report is given as per a specific format. The format contains the site of bone marrow aspiration, the adequacy of bone marrow aspiration, was the bone marrow material which was aspirated was adequate or not. We report regarding the cellularity of the bone marrow. Was it normocellular, was it hypercellular or was it hypocellular? We also report regarding the myeloid and erythroid ratio.